Hello and welcome to our webinar brought to you by BBC Global Services, your go-to source for HIPAA-compliant healthcare virtual assistants. I am your host, Nathan Bush. In each episode, we bring you industry experts, innovators, and influencers to dive deep into the challenges and opportunities facing your healthcare practice. This webinar series is designed to answer many of the questions healthcare providers face, like, am I a HIPAA compliant healthcare provider? What are the best strategies to grow my clinic? What are the best practices to recruit, train, retain, and keep my best employees? On these webinars, we use real life case studies, and we're here to help you stay ahead of the curve and navigate this ever changing healthcare landscape. So grab a cup of coffee and let's get started. Today, we are talking to Christopher Lang with Impact PT. Christopher Lang is a physical therapist, also certified MDT, DPT, and SCS. Is a co-founder of Impact Physical Therapy, which was established in 2020. His primary shared goal for establishing a practice was to provide the local community with a superior rehabilitation experience, which focuses on providing one-on-one manual-based therapy, functional exercises, and evidence-based treatments from highly skilled and effective therapists. Chris graduated from Seton Hall University with a BS in biology in 2002, followed by the University of Medicine and Dentistry in New Jersey, now Rutgers University, in 2004 with a doctoral degree in physical therapy. As a dedicated clinician, Chris is focused on ensuring that every patient and athlete achieves the results they deserve, return back to work support, or their sport or their recreational activity. And we're excited to have you here today, Chris. How are you?
Doing well, Nathan. Thank you so much for having me. Hope you guys are all doing well.
Yeah, we're doing excellent. Thank you so much for taking the time to have this conversation and share kind of some of your experience with BBC Global. For those of you that are watching online right now, just wanted to give you a heads up. If you go over to BBC Global Services website and you check out our healthcare virtual assistance section, Impact PT has taken this kind of conversation that we're having and they put it in an in-depth case study that will give you all of the information that you need in order to be able to onboard, understand what a virtual assistant can do for your physical therapy practice. But today we're talking with Chris Lang, and we're going to hear it directly from Chris, kind of his experience and what it's been like with BBC Global since the beginning. Chris, from my understanding, you were kind of with BBC Global from the inception of our healthcare virtual assistant, right?
I believe so. Yeah. I mean, like you said, we opened back in 2020, which was interesting, opening up a new business during a pandemic. But yeah, so we kind of sought out a few different things that we knew that we needed, and BBC, as well, I guess we'll get in depth more about, kind of checked off a lot of boxes for us. And so, yeah, I believe like it was an evolving thing back then. And I'd like to say that we've made it significantly more efficient for anybody who jumps on board going forward.
Absolutely, guys. Chris is an absolute expert. He's a leader in the physical therapy space. Chris knows exactly what to do to grow and scale your physical therapy practice. And so, if you're hanging in there and you're listening, you might want to silence your cell phone or your distractions. Kind of, if you're watching this on replay, kind of get real focused on the things he's saying. Maybe grab a pen and paper and take some notes because you're about to learn things here from a pioneer in the physical therapy space. Before virtual assistants were cool, Chris was trying to figure out how to utilize healthcare virtual assistants in his practice. And so you're going to hear all about that today on our webinar. So, first, I'd like to ask you, Chris, can you kind of just introduce yourself and give us an overview of Impact PT and the primary services that you offer so those that are watching can have a better understanding of who's speaking?
Yeah, sure. So, like you said, I'm Chris Lang. I do have a business partner who's also a PT. We opened up an outpatient physical therapy clinic in central New Jersey. We offer what we like to think is very highly personalized one-to-one care, really for patients with various, with a variety of musculoskeletal issues, whether it be pain, post-operative recovery, injury prevention, and sports-related like rehab needs as well.
That's awesome. That's awesome. And so, so that the viewers and everybody watching on replay can get a better understanding before partnering with BBC Global Services, Chris, what were some of the main challenges that you faced in managing your patient influx and administrative tasks? What were some of those challenges?
Sure. So, in addition to, I suppose, opening up a clinic in the middle of a pandemic, we did so in a state that is somewhat difficult to do that, really because commercial real estate is quite expensive in the state of New Jersey, and unfortunately, uh, in-network reimbursement is quite low comparatively speaking to other states throughout the country. So right out of the get-go, we're already faced with a couple of difficult uphill battles. But opening up a brand new clinic, we already incurred a significant amount of startup costs as well as recurring monthly costs that we now had. So you couple that with low patient volume from having just opened, it meant that we were pretty financially strapped. Additionally, we were doing everything ourselves in the beginning. So answering phone calls from prospective new patients, having to call those patients' insurance companies to verify their physical therapy benefits, and then calling the patients back to discuss those benefits and confirm if they wanted to pursue our services. Then, if they did decide to come to us, we had to create electronic charts in our EMR platform and schedule their appointments. And so, this entire process could sometimes take over an hour for every new patient that called, and it was entirely non-revenue generating incomes time rather. So, what made it challenging, additionally, is that if we had patients who were physically in the clinic that we were working with at that time and the phones were ringing, we didn't have the ability to pick up the phone. And so we felt that we were potentially losing additional new patients. So we knew we had to find some creative ways to not only maximize our income, but we didn't want to sacrifice patient care or the patient onboarding experience.
Yeah, I mean that's incredible. In fact, the fact that you opened up a physical therapy practice, which is a very hands-on business, in the start of the pandemic, like that is an extremely commendable the practice to be able to do. There's not many entrepreneurs that could have started at that time in a hands-on environment like you and ended up still in business in 2023. Like, what was that like? Kind of give the viewers a background of the time.
Yeah, so I mean, my partner and I, obviously, it was somewhat that we didn't plan on the pandemic, but going into business was something that we had planned on doing for a couple of years, even prior to that. And so I think we actually got slightly lucky because I think had we signed the lease on our current clinic several months earlier, we would have went into the pandemic having just opened the business, and a lot of clinics were closing at that time. In fact, many clinics were closed for a good 3 or 4 months, and so we got a little bit lucky because we actually we started. It's a kind of a long story, but long story short, we opened doors on a brick and mortar place in the middle of 2021. So at that point, clinics were reopening. They were able to take new patients in. And so, as challenging as it was, I think had it happened, if we hadn't opened about a half a year to a year earlier, it may have been a different story because, we would have had all overhead rent costs and everything without any income whatsoever. So, despite the fact that it was challenging because we were getting a lot of COVID related cancellations early on, at least it wasn't a few months earlier when we would have been prohibited from even opening our doors, yet still have all of our rent and everything.
And Chris, that's incredible. I mean, that is a commendable practice that you were able to do during the open during the pandemic and sustain that. And it's a blessing that you're able to make it through that whole process, being open just early enough. So, to my hats off to that. So, I have to ask you though, then because of COVID, the pandemic, and everything that was going on, what was it that motivated you to choose a HIPAA compliant healthcare virtual assistant? Were there any specific needs or goals that you were trying to address as a practice at that time?
Yeah, so I mean, I think it was a challenging time to find staff due to the pandemic because many people were avoiding potential contact with others entirely. And what this basically created was a situation in which not even just PT clinics or medical clinics, but even larger retail companies and even fast food chains were offering well over the state minimum wage to find employees themselves. And so it was tough for us to compete in a market in which we were even looking for part-time help, let alone piecing together all the hours that we wanted administrative support for. So we felt that we needed to find a solution to that, and that was going to, again, maximize the patient onboarding experience for all the days and hours that we wanted coverage, and ideally at a price that was going to help us maintain the lower volume treatment methodology, that we like to adhere to. And then obviously, the HIPAA compliance thing is a major concern, and something that, we take very seriously. And so for us, like BBC Medical's VA services checked off all the boxes that we were looking for at that time.
Yeah. How did the relationship with BBC form? How did you even know to pick up the phone and have a conversation with our staff or team here to set this whole thing up?
I think it was like through some various internet searches. We interviewed multiple companies at the time, just to kind of hear what kind of services they were offering. What was somewhat interesting was, even prior to using BBC, we started using another HIPAA compliant app software program, if you will, that allowed us to not only message patients through the app, almost like a WhatsApp, if you will. It was like a HIPAA medical version of like a WhatsApp, and which is called Spruce. And we felt that if there was somebody on the other end in the form of an administrative assistant, which BBC was offering, we felt that we can kind of pair the two to create a product. Not that it's our product, but I suppose it was an idea that we felt would really work for us. And so, again, we did speak with multiple companies, and BBC was the one that we opted to go with.
Yeah, that's awesome. It's interesting because I'm a big student of John Maxwell, Chris. I don't know if you know who John Maxwell is, but he wrote the book 21 Irrefutable Laws of Leadership. He wrote the book Leader Shift, 15 Valuable Laws of Growth, 15 Valuable Laws of Communication. And John Maxwell has this to say. He says, most people don't like change. They revolt against it unless they can clearly see the advantage it brings. And for that reason, when good leaders prepare to take action or make changes, they take people through a process to get them ready for it. What would you say, Chris, was kind of that process that you guys went through to prepare yourself and your team for utilizing a healthcare virtual assistant?
Yeah, so it seemed like the VAs generally all seem to have prior work experience that dealt with communicating with people in a variety of different ways. But we needed to train our specific VA in a similar way that one would need to train a new office staff member. So the job tasks that we needed the VA to perform were kind of being created in real time. And as we ourselves learn more about the processes of dealing not only with insurance companies, but patients as well. So we kind of were putting together a manual that we felt described basically almost every scenario that we could think of that would result in the VA receiving and making outgoing calls, and outlined how they would respond to those scenarios. So, obviously over the last 3 years or so, it's evolved to make things more efficient than they were back then. But we've added additional job tasks of things that we hadn't thought of early on. So, but I guess you could say it probably took a couple of weeks in the initial stages until the VA was pretty totally independent from needing to question us about whether or not what they had done or were planning to do in that exact scenario was correct. So it did take a couple of weeks for us to uh, kind of remove ourselves from having to oversee like the little things early on.
Sure. And so, did you have a specific vision when you started constructing this VA kind of spruce integration within your practice? Did you guys like sit down and map it out and say, this is what we're thinking about doing? Did you just take action and do it right away? What was your guys' process to get there?
Well, at the very least, we knew that we needed ourselves to be able to remove ourselves from that onboarding process that, again, was somewhat tedious and time consuming, but also again non-revenue generating for us, at least, because we were potentially taking ourselves away from time that we could have booked other patients. But yeah, so I think that early on we knew that at the very least we needed administrative support, but I didn't think we realized at the time how it would have evolved into what it has become. I mean, obviously it's administrative support, but there's so many things that I think that we didn't realize we'd be able to utilize the VA for early on that we've been able to at this point in time. So it's not just, you know, making phone calls, but if we need, if we get phone calls all the time from physicians who want stuff faxed to them, reports and what have you. So there's a lot of stuff that again we probably were handling ourselves early on, and then said, hey, so and so's the VA is doing such a great job with this. It sounds like something they could tackle as well. And so it's just evolved and evolved and evolved, and it's really something that we're quite pleased with.
Yeah. One of the things that a lot of the people who are watching this on replay, by the way, if you're watching right now or watching on replay and you just caught right in the middle, we are speaking with Christopher Lang, who's one of the owners of Impact PT. And he was one of the pioneers of this whole virtual assistant movement that's happening throughout the entire physical therapy world right now. They had to find a way back during COVID. They opened up a clinic, and so they had to find ways and efforts in order to be able to overcome the hike in the wages inside of their particular area, because people were being paid way more than minimum wage at that time for some of the roles and tasks that they needed, and so they had to find affordable solution. They were dealing with a number of processes while still trying to deal with patient care with limited space inside their clinic, and so he really was one of the fathers and the pioneers of this whole movement. He did the research, found the right company, partnered with BBC Global Services, and that's where this whole kind of thought process came from that helped him to be able to grow through that pandemic. And so, one of the questions, though, that people that are watching will have right now is, how was your initial experience with the healthcare virtual assistant? I mean, because you're a little bit different now. Things are at BBC Global Services. I know that it's extremely smooth onboarding process. We have training manuals in place that can help people put things in place for their clinics. But can you walk us through your onboarding process and how it aligned with your clinic's needs? And kind of, I know we talked a little bit about how you've added a lot more tasks than when you first started. But think back to that initial onboarding. What was it like? Trying to work as a pioneer in the industry, adjust things, and onboard a virtual assistant?
Yeah, I mean, it was, I'm not going to say it was challenging. It was a little bit tedious because there's so many different, it's almost like this, when you're taking a phone call, it's almost like this choose your own mystery novel where there's, the answer to one question can dictate what the next question is. If you're dealing with somebody, for argument's sake, that was involved in a car accident and they're trying to seek therapy through their auto policy, it kind of leads you down various questions that you wouldn't have asked if they were coming in just through like their commercial insurance and so on and so forth. And so there was just so many different scenarios, if you will, that we needed the VA, the virtual assistant, to be able to handle once we removed ourselves from taking those phone calls ourselves. And so developing the manual was for us, at least, it was somewhat tedious because we had to think about all the scenarios that could occur, and then, all right, like, how do we want the VA to respond in all these scenarios? And so yeah, that was somewhat challenging, but it was a one-time thing because those things don't change too often. So like once they're in place, it just kind of rolls. So it was somewhat tedious and time consuming to kind of put that manual together for us. But I think it was extremely helpful because the VA picked up on it right away. And so the onboarding process, once the VA kind of had the manual, was made our lives significantly easier at that point.
Yeah. So back to that whole manual concept, there were a couple things that you guys had mapped out. What are some of those couple of those scenarios that just kind of off the top of your head that if somebody's preparing to hire a VA, that maybe they should be thinking through? I mean, that would be very helpful for a lot of people who are considering hiring a healthcare virtual assistant or a medical virtual assistant right now during these times. What do they need to be thinking about? Like, what are those tedious things that you started to map out?
Yeah, like, so all right, so I guess because my business partner and myself, we worked previously, we worked most of our careers in larger hospital systems, so we were pretty much completely removed from having to ever have to deal with billing questions or um, insurance benefit questions, because there were departments in these organizations that answered those questions if they arose for patients. Being in private practice, we were answering all these questions, and a lot of it was new to us. So it was helpful for us to have a VA that had some familiarity with, like, okay, this patient has a deductible that isn't met. What does that mean? What is the patient out of pocket responsibility going to be? So having somebody that can answer those questions was invaluable. I mean, it was, you know, so that, this way, like, if she didn't have to put somebody on hold or what have you to call us to then re-answer a question, so that it basically having somebody that could answer medical related insurance type benefit information questions was quite helpful. And if you're going to be going into a practice that deals with any sort of in-network contracting and reimbursement, having somebody on staff to be able to answer those questions is vital.
Yeah, so billing questions, insurance benefits questions, medical type questions, you should probably be mapping out those types of things that you get asked on a regular basis. Document those so that you can have a response on how you want your specific VA to handle those. What process you want to put that specific question in. Do you want the VA to take that all the way to the finish line, or do you have an internal team that's going to take care of those things? Those are all different ways that can help you prepare and get ready to have that virtual assistant. I mean, you're hearing from the person who kind of walk through that process all on their him and his partner's own, trying to craft this after leaving a large medical hospital network where this was all new to them answering the questions themselves was new to them. And so one of the things that he's saying that he really liked, just for clarification for you of the audience, is that BBC Global hires people specifically with that kind of industry experience as well, that provide some support and help, so that there's not a whole bunch of training where they just make sure they're following your policies, your procedures, and your practices. And so that brings me to this question here, Chris, and that's, how have healthcare virtual assistants from BBC Global impacted your relationships then with patients? Can you share any specific instances where BBC Global has had an impact with a specific patient?
Yeah, so I would say, in the day and age that we're now living in with modern technologies, so for the patients that we serve who are kind of in tune with mobile applications and text messaging and what have you, our medical VA gives them the gratification of very prompt responses. So if they need to make or change appointment times or have other requests, many of our patients just send messages through our secure app, and some even are comfortable just sending SMS text messages. So all of these are filtered by the VA, and they're answered in real time, which patients love, especially if they're busy and they don't have time to pick up the phone and make a phone call. So many established patients never have to call our office at all, and they just communicate in one of these ways. But of course, for anyone who does call the office, the VA is always there to pick up the phone as well. So we've had many people compliment us on how pleasant, our VA is to speak to and deal with over the phone as needed, or just through messaging. So it's been a hit.
Yeah, that's awesome. That's awesome. Thank you for that. So there is the question of the day, which everybody's wondering, because the title of this is based upon the case study that you guys did with us, and that was welcoming 10 new patients into your clinic. Let's dive into the heart of today's topic. How did our service help you welcome 10 new patients in just 1 week during this kind of hectic time of startup and all of that?
Yeah, so I mean, I guess as we were gaining a little bit of local popularity in the area in which we opened, I guess word of mouth referrals started to come in, and as well as we're on kind of the main strip, and so I guess as people started to see our clinic, it wasn't uncommon for us to start getting more phone calls for new patients. But that was a couple of years ago that this occurred. But there was this 1 week that the phone just was ringing off the hook, so to speak. And so I had mentioned earlier that the amount of time that it would take us, my partner or myself, to kind of funnel through a new patient intake from the time that that phone call came in to the time that they were scheduled and everything was input into the system and all the necessary insurance information was gathered, you were looking at, if you were lucky, you were looking at 30 to 40 minutes, because at times the insurance company puts you on through their own automated hold system. And so if the phone is ringing on the other end, like, you can't just, pick it up. So the amount of time that, so this one particular week, I guess we had gathered 10 patients that were kind of calling sequentially, and had we had to handle that ourselves, it would have been a complete nightmare. So it was nice that that occurred after the VA was up and running and independent. Certainly thankful for that. But yeah, it was seamless. It's interesting because you know we don't our phone calls get kind of funneled directly to the VA. And so the phone isn't even ringing in the office, so the patients that are currently here don't even realize what's going on in the background. So if something seemingly crazy is going on, like, they're not aware of it. It's not like somebody's frantically picking up the phone, like, it's happening on the back end. So it's kind of nice.
Yeah, that's incredible. And that leads us to the question then naturally is that there's certain tasks, things that this VA now is doing in your organization. What are ways that healthcare virtual assistants help improve the daily operations of your clinic?
Yeah, so
I know we've talked a little bit about it, but let's get into some specifics that your VA does to help so that everybody can have an idea of what a VA can do, a healthcare VA can do in their practice.
yeah, sure. So the way that we have our phone tree set up, if you will, when somebody calls our business phone, our business line, they have to choose an option as to the reason for their call. I would say the vast majority of phone calls are being funneled directly to the VA. So there are certain situations where we would want the phone call to come directly to us. Let's say if it was a doctor's office calling. But that being said, those are less frequent phone calls. And so it's not uncommon for an entire business day to go by and our office phone line hasn't even rang. And this is because those phone calls are being forwarded directly to the VA, and she's handling all the front office tasks that would normally be handled by someone sitting in the office answering phones. So, this allows us to maximize our income generating space because we don't have to have a desk somewhere for somebody to sit here and do that in the office. So it also saves
Sure.
us in that it's significantly less to use BBC services than it would be to employ somebody doing the equivalent tasks, in the office, like I said. So, we actually have our VA, available for 50 hours a week, and that, trying to piece that together with part timers or full timers would have been quite challenging and expensive. So, this actually, on the flip side, it kind of allows us to find a little bit more competitive in-office assistants, people who we need in the office to help wipe down equipment or put equipment away and stuff like that. So I had mentioned earlier that some of the other larger retail chains that were paying a bit more than the minimum wage. We weren't able to have the best of both worlds. You couldn't have somebody in the office answering phone calls as well as somebody in the office cleaning equipment and what have you. So this kind of allows us to have the best of both worlds, where we don't need to have dedicated space for an assistant in the office just to answer phones, and it allows us to kind of offer our techs or our PT aides, if you will, a little bit more money that maybe than our competitors, so that we can find competent staff that's available when we need them.
Yeah, what an incredible tip that Chris just gave you about how to structure offers to team members and hire and retain top talent in your local market. He gave you an insider tool is that he's been able to reassess kind of the way the overall practice expenses cost the organization and prioritize the investment in the proper resources. So where those specific things need to be. This is what a diversification of labor force will help you do when you utilize international labor through healthcare virtual assistants. assistants. And so that brings me to the question then, how effective has the feedback and communication loop been between your team and your assigned healthcare virtual assistants with BBC Global? How does that communication work? How do you guys communicate back and forth, that kind of stuff?
Honestly, it's been incredible for us. I mean, I had mentioned earlier that we use this secure HIPAA compliant messaging platform, which
Spruce, right?
yeah, it's called Spruce. So our patients can communicate not only with our VA through Spruce, but that's how we mostly communicate with the VA as well. So imagine if you were, let's say you were in some sort of group text, if you will, and I was texting you, and there was a third party in that group text as well. I'd be able to kind of send you an aside message without I could send that third person in the side message without you seeing it, and we could kind of communicate within that same group text without you seeing what we're saying. And that's how we communicate. That's how we communicate with the VA, and that's how the VA kind of communicates through with the patient. So if they choose to use the messaging feature, it's through like a messaging application um, within the application, but it's also kind of has like a caller ID, if you will. So any incoming phone calls are also listed in the Spruce application, and she'll comment what the phone call was for, how she handled the phone call. If it's something that we have to address on our end, she gives us the message of what we need to do or what have you. So it's constant communication. Is needed, as little or as much as you need, but it's constant and it's fantastic. I mean, things are handled in such real time. It's as if there was somebody physically here, even though they're not.
Yeah, did you have to change your phone system or make any investment, any additional software or any of that kind of stuff in order to hire a healthcare virtual assistant?
Well, I think I mentioned we started using Spruce before the virtual assistant, and the reason being is because before we opened our brick and mortar clinic, we were subletting some space elsewhere, and so my business partner and myself were working in other capacities, and we were working on the side in the place where we were subletting, and so we needed some means of incoming phone calls to be forwarded to us so that we can answer the phone. So if somebody through Spruce, if somebody were to call our business line, we would get the phone call on our cell phones. And so the first person to answer the phone more or less took that phone call. Once we got to our brick and mortar clinic, we didn't have to do that any longer. We just forwarded the phone calls to the medical VA once that was up and running. So that's basically how that started.
Yeah, so no additional cost, no additional software to purchase. You're literally able just to hire your person, have them kind of supplement or augment some of those costs that we talked about earlier, and just essentially start training and developing with that person. So that's fantastic. Have you noticed any changes in patient satisfaction or retention since implementing the virtual assistant service?
Yeah, absolutely. So, I mean, this might sound somewhat silly, but in the PT world, the physical therapy world, it's somewhat easier than you might think for patients to fall off the schedule. So perhaps they forgot to make follow-up appointments if they canceled their last visit, or if, let's say, they ran out of authorization. Our VA is on top of everything. So she's trained to track when patients are out of authorizations and prompts us to do what we need to do in order to facilitate new authorization. um, Also, she's tracking which patients, active patients, perhaps don't have any scheduled visits. And so there's spreadsheets that she updates routinely that we check, and we give her feedback on whether or not we want her to reach out to those patients. So, it's been great. Patients love the fact that we're in constant communication with them. And she's really implementing a lot of that.
So it sounds like having a healthcare virtual assistant actually helped to improve communication with patients because now you're able to have more touch points, follow up with patients that have fallen off. And it actually sounds like treatment plans might be being followed through even better because you guys are able to make those detailed follow ups and then also still work with patients that are in your clinic as you continue to grow and scale.
Yeah, and it's what's interesting is I had mentioned earlier that through the messaging application, which a lot of patients actually prefer, if the VA has to make a phone call that has her sometimes on hold for a half an hour, she's still able to send out these messages. So she's kind of killing two birds with one stone. She doesn't have to wait to hang up the phone call with an insurance company to maybe call a few other patients who fell off the schedule. If they have downloaded the app or they've communicated with us through messaging, she's doing these things simultaneously. So it's very efficient.
Chris, it kind of sounds like you and your partner subscribe to this quote from Wayne Dyer, and that's if you change the way you look at things, the things you look at change. And you guys had that thought process, that vision for the industry to kind of redefine the front office role and some back office work. And it seems like that has been a positive experience that has helped your organization. Is that safe to say?
Oh, it's absolutely safe to say, without a doubt.
There is a tool that you guys have access to through BBC Global Services, and it's a productivity tool of your virtual assistant. I know this has gone through some iterations, but up on the screen, back when we did our healthcare hiring blueprint webinar, which you can go back on the YouTube channel and check out the healthcare hiring blueprint, we shared with you this report, one of the initial iterations of this report from Impact PT, that shows the productivity of the team members, so that you're not just wondering what the staff member's doing all day. You actually get documentable, follow-up, actionable items that you can measure, track, and make decisions on. How has the reporting from BBC Global Services helped your business overall?
Yeah, so I would say that in the beginning, I would say we probably were looking at that a little bit more with a fine tooth comb, because if phone calls got, so I should point out that we did have to have our medical VA set up with like a Google phone service, if you will. So it has like a local area code number. So if she were to make an outgoing phone call, it is from her Google phone. So sometimes incoming phone calls or return phone calls, if you will, might go to that particular Google phone number. So the report was helpful in knowing, I suppose, like how many incoming and outgoing phone calls she was handling, how many new authorizations, she was handling, things like that. But I would say that we've developed a relationship where at this point, like, we know what she's doing, because as we see new patients kind of populate our schedules, which is kind of happening ongoing and constantly, like, we know what she's doing, and we don't necessarily fine tooth comb those reports as much as we used to, but they're there if we want them, and they're quite informative.
That's awesome. Now, your business partner is Mark Plonner, right?
That's correct.
Mark actually gave us a testimonial in the case study report that you guys did for us. And Mark actually had this to say about Wormly. Your healthcare virtual assistant is able to work independently and rarely has to contact us, you guys, with questions. This has helped us achieve a vision for providing high quality, unrushed care while growing our practice. And it kind of, that, I think that summarizes kind of the things that we are talking about here today on how a healthcare virtual assistant has really helped to scale and grow, help you scale and grow Impact PT. Now, with that said, every single business has to make business decisions. It can't just be just because it helps us do a little bit more or less work. Like, there's also got to be an ROI or a growth associated with it. So can you discuss for the audience and help them understand the return on investment or overall business growth that you've experienced since partnering with BBC Global Services, one or the other? How does that look for you?
Sure. So I guess I'd like to just point out by saying a couple of really nice perks for us in using BBC services is that, let's just say, for argument's sake, that the VA is off, like whether it's a vacation time or if she's out sick, we already have an assigned backup. So we ourselves are not having to pay somebody additionally to come in to fill in for somebody that we're already paying, even though they're not here. Let alone having to then fill and pay that additional person. So our business growth has been really good. We're still growing, but we're 2.5 years into this, and since opening, I'd say we're 60 to 70% busier this year than we were last year. So for us to be functioning at that point, it's fantastic, and we're probably on the verge of hiring another clinician ourselves, and so that's going to undoubtedly result in increased scheduling needs, as there's another person that will be here that has an open schedule, and there's really no doubt in our mind that our VA would be able to handle the influx of that, going from that jump from having 2 clinicians to 3. There's really no doubt whatsoever that will be a seamless transition.
So it sounds like with this growth that there's some opportunity for future plans with a continued partnership with BBC Global. At bare minimum, it sounds like your VA that you currently have in place will be able to help and support in your immediate needs. But do you have any future plans continuing your partnership with BBC Global Services? And if so, what does that look like to you?
Yeah, so I mean, our long-term goals for Impact Physical Therapy are to grow our business model and hopefully up future clinics around the surrounding area. And when that time comes, it's going to be interesting to see what ratio of clinics to VAs is actually necessary. So it's hard to say at the moment if the influx of new coming calls and tasks that would warrant needing a VA out of the starting gate is even needed or not. And this is really a testament to how efficient our VA is. I honestly think if we had a sister clinic right now, that our VA would probably be able to handle the workload of both at the same time. But honestly, that's my opinion. We'd have to put that theory to the test when the time comes. But hopefully not. Hopefully, in the not too distant future, we'll be able to see how that goes.
That's awesome. That's awesome. So I have to say thank you to you, Chris, for being with us on the show today. And I always like to ask guests of the show this final question because I think it really helps to give a clear viewpoint for people who are on the fence, people who are considering a healthcare virtual assistant, and they just don't know what it's going to be like to have a healthcare virtual assistant. And the question is this: so what advice would you give a clinic owner considering hiring a HIPAA compliant healthcare virtual assistant?
Sure. So, I think it's extremely important for clinics to try and offer the utmost level of care, and in order to do that, in a difficult market with low in-network reimbursement rates, and trying to minimize overhead monthly costs, the medical VA allows clinics to do that without sacrificing front office tasks, and it's done very efficiently. So, like I mentioned a moment ago, there's always someone available, even if the primary VA is not, which is not common, by the way. She's very available most of the time, but we ourselves don't have to go and scramble to find someone to work if there's sick call outs or vacation requests and things like that. It's already taken care of. So I really couldn't recommend the services of BBC, the medical VA services, enough. It's really been a game changer for our clinic, and there's no doubt that other clinics wouldn't be able to say the same if they went that route.
Well, thank you so much, Chris, for being a part of our show today. Those that are watching on replay, if you have some questions, you're welcome to put those in the comments, whether they're from me or Chris, and one of us will get back to you and get you an answer to whatever question that you have. Also, for those that are watching that have come to the end on replay, if you are interested in a healthcare virtual assistant that Chris and I have been talking about for the last 43-ish minutes, 44 minutes, go to bbcglobalservices.com and check out the healthcare virtual assistant section on the website. You'll be able to download the entire case study there, and there'll be able to be somebody that can help you. One of our virtual assistants will be able to answer any questions that you have right in the live chat function on our website. So I'd recommend go ahead and do that. And set up a time to talk with somebody if you're serious about a healthcare virtual assistant. We will help walk you through the process. BBC Global Services will take you step by step through the onboarding process to ensure a smooth transition so there's limited to no disruption in your business as you get the healthcare virtual assistant set up. Any final words, Chris? I'll let you have the last word.
No, just thanks for having me. I'm happy to kind of spread the word on the services that BBC offers, and hopefully other people can see the benefits and go the route to kind of help make them more successful, like it's helped us.
Thank you so much, Chris. Have a good afternoon.
You too, Nathan. Thank you.
Bye, guys.